This is a 60-year-old lady whose jaw is locked. She's got nature's arthrogram, which is a large effusion tracing out the recesses of the capsule, which you've heard about in other vignettes. I want to tackle how we might grade this TMJ using some of the grading systems you've had before, and how some of them really apply and some of them don't. For instance, if we use the ADA criteria for closed mouth assessment of the meniscus, first thing you got to do is figure out where's the posterior band. And in earnest, I'm not sure, but if I had to pick out where it is, I'd say this is the meniscus, that's the anterior band, that's a scar, and that little bump right there is the posterior band glued to the back of the articular eminence or anterior condylar fossa. So if we assume that this is the back of the posterior band, front, back, this is our anteverted condyle, this would be 12 o'clock, and we'd say, okay, there is our 12 o'clock position. So our meniscus is maybe 30 degrees off the 12 o'clock position. Say, really not that bad. So the American Dental Association criteria of grading grading closed mouth subluxation, not really that effective in telling you what's going on in a case like this. And by the way, this is an open mouth view, but the condyle isn't moved. It's not open, so it looks exactly the same as the closed mouth view. So that ADA criteria really doesn't work or apply here. What would be the Wilks or Voigt criteria? Well, that's pretty easy. Patient has arthrosis. It's fairly severe. There are no attachments in the back, so there's basically attachment or disc complex rupture or perforation, and there's severe osteophytosis. The only other stage that is going to be worse than this is in the Voigt staging system, complete and utter destruction, an end-stage joint, which this is getting to. So this is going to be a Voigt or Wilks 5 on its way to becoming a Voigt 6. So in this case, these other grading systems, emotionally, socially, and medically, fit better with this case than simply using ADA criteria for meniscal or disc displacement.